So before we get started for the day, we want to take a couple minutes to review who's coming in and what they need and what they've got going on. Our first patient, Ms. Jones, is someone I think you both know well. She's a type 2 diabetic with hypertension and high cholesterol. She, it looks like, hasn't had her flu shot. She has had her Pneumovax, though, and her A1C is coming due, so we'll need to get lab tests for her.
Okay.
She's seen the eye doctor this year, and we did a foot exam last visit, so we're set for that stuff. She had a self-management goal that actually Jordan set up with her last time, of changing from soda to changing away from soda anyway. I'm not sure to what.
To water.
So checking in on
Yes.
that would be really good.
Okay.
And see how she's doing. So, and otherwise, she's really been doing pretty well.
Okay, does she need an appointment with Zoria or anything to check in with
good
her
question.
diabetes?
Has she had one? I think she did last month, so
Okay.
she's set for now. That's a great question, though.
I'll ask her when I give her the flu shot. Rita.
Oh,
Okay.
good. Perfect. And then next is Courtney, and she, it looks like, is overdue for her last PAP, and has been coming in for depression, so she'll need a PHQ-9 as well.
I can check and make sure she's not going to a GYN for her, or family planning.
That would be excellent.
And she's also missing her flu shot.
Oh, thank you. Okay.
Come in.
Good morning.
Hi.
How are you today?
I'm well, thanks.
My name's Jordan. I'm Dr. Lacey's medical assistant. I'm part of his care team.
Nice to meet you, Jordan.
Nice to meet you too. What brings you in today?
Follow up for my diabetes.
How did you check your sugar this morning?
I did.
And how was it?
It was pretty good, 123, and that was before breakfast.
Okay, are your sugar staying consistent?
Pretty much.
Are you staying on top of all your medications?
I forgot to take my pills this morning.
Okay,
My hydrochlorothiazide.
alrighty. I'll keep that in mind when I'm taking your blood pressure.
Okay.
How's your self-management goal going of not drinking soda at night?
Pretty well. I've substituted bottles of water so I can grab them from the fridge, so that's worked well.
That's excellent. And do you have any new self-management goals for today?
I want to try to get to the gym 3 times a week instead of 2.
Okay.
So, trying to rearrange my schedule for that.
We'll check up on that goal the next time you come for an appointment.
Very
I'm
good.
going to get your blood pressure. Your blood pressure's not bad, 137/78.
Oh, good.
But just remember to take those pills in the morning.
I will.
Let me check your pulse now. Your pulse is good too, it's 60.
Wonderful.
Are you interested in signing up for our patient portal? It's a way that you can get your lab results online. You can email Dr. Lacey, you can refill prescriptions,
Oh, that
And-
sounds great.
and his care team will get back to you as soon as they can.
That sounds a lot more convenient. I'll definitely do this. I just fill it out here and
Yep.
give it back to you.
And then the city that you were born in will be your security code. It saves you a walk into the office, and it saves you a phone call.
That'll make my life a lot easier. Great.
You're welcome. It was nice to meet you,
You too.
and Dr. Lacey will be with you shortly.
Hi, Dr. Lacey. How are you?
I'm fine. Nice to see you.
You too.
How are you today?
I'm doing great.
Oh, good. Jordan said that you're doing really well on a lot of things.
Thank you.
Yeah. So she told me that you actually have succeeded at your self-management goal of cutting out sodas and switching to water, is it? Is that right?
That's right.
That's fantastic.
Thank you.
So how'd you do that?
Well, I just made a decision to do it, and it turned out pretty simple. I substituted the bottles of water
Mm-hmm.
for the the glass containers that I carry to work.
Mhm.
And once I instituted that change, it turned out to be pretty easy to do.
That's great. Has it been good for your sugars too?
It has. This morning it was 123, so.
Fantastic. Congratulations.
Thank
That's
you.
super. Good. And, you know, as you know already, you're usually in pretty good control, and this will really help as well.
Right.
So that's great. And Jordan told me something about exercise as well. Is this true?
I have been getting to the gym twice a week, but I'd really like to up that to 3.
Oh, that would be great.
It's been difficult because they don't schedule classes at the right time of day.
Mhm.
But I'll just go in and use the machines and try to up it to 3. You know.
3 is a great next step. I wouldn't want to let you get away with only 3, though, eventually.
Okay.
So you might want to keep in mind that our goal is 6.
Okay.
And it doesn't have to be 6 days of going to the gym for big exercise.
Right.
It can be just taking a walk. And a 30-minute walk is just as good for you in terms of how things add up. But I'm going to be thrilled with 3.
Okay.
3 is a big difference from 2.
I'll keep working on it.
That's great. That is wonderful. Good. We'll check in on it next time I see you as
All
well.
right.
I just want to hear how it goes.
All right.
Good. Anything else that you're concerned about today?
Well, I've been sort of bad about taking my meds on a consistent basis. I just tend to forget.
Oh, Jordan told me you'd forgotten your blood pressure medicine this morning.
Yes.
What do you do to help yourself remember? Anything?
Oh, I really don't have any methods. I try to take them after I've had my breakfast, and sometimes I'm just, getting ready for work and I forget.
Mm-hmm. And it's really common and really understandable. Life is busy and mornings are busy. But any tricks that we can offer to help with that might help and would help. I mean, today your blood pressure is just a little bit up at 137, and that might be from having missed a dose of your hydrochlorothiazide this morning.
Exactly.
Maybe.
Any suggestions you have?
Well, do you use a pill box to remind yourself?
I don't.
I love my pill box. It helps me remember what day it is every morning. And so you can see if today is Wednesday and it's still closed, then I need my Wednesday pill. And putting it someplace where you're going to see it. So that, for instance, if you brush your teeth after you have your breakfast, putting it next to or even rubber banding it to your toothbrush is
a great idea.
an easy way to take care of that. And just helps you remember and stay in the rhythm of taking your medications.
Right. I think that's what I need, a routine.
Yeah, it does help, just like anything else.
That's a good suggestion. I'll try that out.
Great. And really, even at 137, your blood pressure is above our optimum goal, but not above to the point that we would need to make a medication change. It's likely that you'll be able to control this with taking your meds every day.
Okay.
Does that sound possible?
Yes.
Excellent. Excellent. Good. This morning, the nurse and Jordan and I worked to look through your chart a little bit to see, is there anything that we've forgotten to do or that's due for you? And it looks like you're up to date for most everything, which is wonderful. You don't have a flu shot listed in our records. Did you get one this year?
I did. I got it at the free clinic in town.
Excellent. Do you remember when that was?
That was October 15th.
Okay, we'll put that in your chart. Great. And it looks like you're going to be due for your mammogram in February. Do you want us to give you information on how to contact them to schedule it for yourself, or would you like us to do that for you?
I'm all set. I'm already on the schedule for that.
Fantastic. Good. Okay. And otherwise, you're doing wonderfully. You're up to date for your blood work. You're up to date for your eye exam. We checked your feet last time, and so we don't need to put you through taking all your boots off today. And otherwise, you're doing great. What I'd like to do is just to be sure that your blood pressure is not trending upwards. I'd like to have you come and see our nurse, Valerie, in 2 weeks, just to recheck your pressure. And then if it's high, I'd like to see you in 4 weeks.
All right.
You're also due for your lab work. You're not quite overdue, but due. So the hemoglobin A1C is the blood test that tells us the average of the sugar over the last 3 months. Likewise, it's time to recheck your cholesterol, and we'll check the salts in your blood, the potassium, and your kidney function with the hydrochlorothiazide. So we'll do all that stuff. So that's fasting labs, and that way we can be sure that you're in good control.
Okay. And how will I know the results of those?
Good question. Are you on the patient portal?
I am going to sign up for that today.
Oh, good.
Jordan told me about it, and it sounds like a wonderful idea.
What we can do is we can send you the results by the portal and send you a note telling you they're okay.
Wonderful. And if they're not okay, what will happen?
Then daily the nurse and Jordan and I go through all of the labs that have come in, and if there's anything worrisome, the nurse will also give you a call.
Oh, excellent.
Yes.
Okay. All
Yeah,
right.
so we'll be in touch and make sure that you're aware of anything that's significant.
Very good.
Anything else I can do for you today?
I think this has been very helpful.
Great. It's always a pleasure to see you.
You as well.
Take care, and I want to see you in 3 months. I'm Dr. Steve Lacey. I'm one of the primary care doctors, a med-ped doctor at Harbor Community Health Center in Hyannis. You've just seen a condensed version of most of our day, basically. We start with a discussion as a group, as a team, of all the patients for the day, our huddle. And then during the visit, we split up into pieces of the team, with Jordan gathering information, me reinforcing it and gathering more information. And then after the visit, the nurse will be checking in for how the patient's doing, sending a note about the lab results, and following up in person for anything that's abnormal, like the blood pressure in this setting. That's how we try to work together as a team, and that's different from the old-fashioned medical approach, where we would focus on whatever concerned the patient today and whatever seemed next in line, rather than looking more broadly at the patient. Also, Jordan did an excellent job of reviewing a self-management goal, which is really one of the keys to the patient-centered medical home. Putting the patient in charge of their health care reminds the patient that really I can do this, and that without the patient's engagement, we actually don't make that much difference usually. So engaging the patient, having a discussion, reinforcing what they've succeeded at is really an important part of the patient-centered medical home discussion when any of the providers are working with the patient, whether that's the nurse, the medical assistant, or the provider.